repellent, especially for kiddos, that would be awesome.
I'm going to go ahead and hit the start recording button and just.
Do you think we have everybody?
Yeah, this is everyone that RSVP'd and volunteered.
Great.
So just be advised that this meeting is recorded. It's a public meeting, so the recording will get posted on our webpage there for PACES.
Julia, should we do quick introductions?
Yeah.
What would help me is maybe understanding what your interests are in behavioral health based upon your background. If you have a specific motive for being a part of this work group, or are you just one of those team players and you just wanting to kick in? Maybe Sandy, you first.
Yes, I'm Sandy Nygaard. I'm the pre-hospital coordinator at Banner Ironwood and Banner Goldfield. At Banner Ironwood, we have an awful lot of pediatric behavioral health patients, and we have extremely long times that we hold them. So I am so interested in getting help not only for them, but for our staff.
Okay. Good. Thank you, Sandy. Mickey?
Okay, so I'm Mickey Kovach. I'm at Banner Desert, Banner Gateway. My interest is just because we have a big pediatric department, and we also have lots of behavioral health kiddos. I do all the statistics for the behavioral health, so always been a big interest. And I understand you walk over to peds and all you see is sitters sitting with the kids watching them. So it just ties up the department for so long.
Yeah. And I'm just going in the order of my screen. So Jancy, you're next. Hello, good morning.
Is that me? Looks like there's a little bit of an echo.
Yeah,
Yeah,
Sandy,
Mickey, your mic was a little bit quiet, so I don't know if. Here, let me try to.
I think Sandy, your mic might have a little bit. Yeah, there you go. Thank you.
All right, sorry about that. I am Jansen Neff. I work at the Arizona chapter of the American Academy of Pediatrics, managing the PPEC program. And we hear at almost every site visit how much the hospitals are struggling with holding behavioral health patients in the EDs. So,
Okay. Thank you for that, Jansen. That's actually a good primer. I'm on the steering committee for the PPEC program, and I was going to echo a lot of what Jansen just mentioned, and maybe we can talk about it for some background information. So Shelly, Julia, can I just jump in? Or is there something else you guys want to do for housekeeping?
No, go ahead and jump in.
So obviously there's a huge need with behavioral health. And the echo came to PACES of, what resources and what support can we offer without really much in the way of a directive as to what they wanted us to focus on. I think the reality of it is the problem is so deep that a single solution is not there, but everybody knows we need help in the processing. Julie and I had kind of a primer meeting for this where she and I just talked on a meeting to try to see where we were going to go and where we were going to steer this work group. The premise of that meeting was the fact that we were not sure exactly what project we can move going forward. It's my humble opinion of witnessing the site visits with PPEC and everything that everybody is having difficulty with behavioral health cases and boarding in the ED. And I think a lot of that stems from the restrictions in bed capacity in our communities. The small communities have to ship them either into Tucson or Phoenix. I'm familiar with the Tucson environment, and there's not a lot of inpatient beds, so we board a lot too. Meanwhile, I think behavioral health issues have elevated and maybe escalated with the COVID isolation. Personal opinion as a pediatrician is that kids just do not like to be isolated. So it is a big problem. What we are trying to do here is maybe do a brainstorming session because we're we're really early into this concept. If we can identify a project that we can step forward with, and being the pragmatist, I'm more inclined to try to tackle a project that has a likelihood of success and completion to result in a product. Then we essentially bring it back to PACES and we put it on the agenda, parliamentary style. We get a movement, we get a second, and we get it approved as a project going forward. And the screen that I wanted to show you, let me see if I can't do that real quick. Thank you, Shelley. Screen one, it makes me choose screen each time. Can you guys see my screen?
Yeah, we see the
So
education.
this is the Bureau of EMS and Trauma, and hopefully you guys are seeing my mouse moving. The Bureau of EMS and Trauma website, and this is their EMS education tab. So you can go to the EMS, the education home, and look at the things that have been done and what's available. PACES, I think, you know, the ones that we can really boast about is historically we're involved with ACEs. More recently is the Safe Sleep. Safe Sleep, and then even more recent than that is the tracheostomy training. And these are products that are coming out of our committee. So, I mean, kudos to our group in working towards that going forward. Narcan, we're going to have another small group that we're going to be tackling also going forward. So education is something that we can definitely contribute to and promote. One of the things that I saw in here was capacity. So that falls in line with behavioral health, because in the field, an EMS agent will need to decide if an individual has capacity. And I'm going to minimize this. And if I were to click on that capacity line, it brings me to this slide set. And this is an educational slide set that's available on the Bureau of EMS and Trauma website. And this is really the only behavioral health thing that I'm seeing. And Julia, you can shout out in a minute and tell us if there's more stuff out there. This one, fairly long slide set, almost 60 slides. And Dr. Bradley, looks like Dr. Bradley put this together. And I emailed Amber Rice because I found a couple of things that I want to edit already. But that being said, if you scroll through, and I'm just doing this really quick, and I'm just trying to prime us to maybe have some discussions on this. If you go through this, there is very little on kids. So slide 10, you know, comments on minors. That should probably say if not. So that's a correction we probably, or feedback that we want to, you know, give to the Bureau. Probably should say if not emancipated minors, but I digress. And then if you go down to slide 50 here, that's really the only places that we see children mentioned in this issue of consent and refusal in the field. Okay. So the point I'm trying to illustrate is I think the slate is clean. We don't have a whole lot as far as educational material and management. Now, in response to the comments that you guys gave me earlier, PACES really does focus on the pre-hospital setting. And I'm going to unshare now, Shelley, if that's okay. All right, do I have everybody back normal form? Okay. So again, food for thought, kind of a primer. There really isn't a ton of things out there as far as educational material. PACES does want to focus on the pre-hospital environment. I know each of you had commented on the problems in the ED, and those are real. You know, I live that world too. You know, EMS does not take refusals for minors, and behavioral health tend to be transported. So unless you have a crisis facility that will take acute crisis events outside of the ED, they're coming to the ED. And they come to the ED and they sit until they can find an inpatient bed. Now in Tucson, and maybe you guys can tell me what's in Phoenix, but in Tucson, we have 2 outside behavioral health facilities, actually 3. The CRC, Sonora, and Palo Verde, who will take acute crisis cases. But not all EMS agencies are aware of that. Their default is to transport to the emergency department. Similarly, their reimbursements based upon transport to the emergency department. So community education, what's available, how can we better utilize our distribution of a limited resource? So these patients don't ultimately spend so much time in the emergency department. Sometimes that goes all the way up to, Department of Health for Behavioral Health and, the regional funding and what's resourced in the community. Maybe expanding the scope of lobbying for more facilities, but we can at least make people aware of what services are available. Similarly, we can work towards creating an educational module. Now, Sandy and Mickey, in answer to some of the things that you had commented on, PEDPAC, Pediatric Prepared Program, under Arizona AAP, does have resources. They have and if you guys are PEC members, you guys have access to this. They have an online repository, and there is shared documents on behavioral health management in ED. So if they're sitting for a week, what's the ongoing day-to-day maintenance of a behavioral health patient? Strategies like that. So I just want to throw that out there. And again, not PACES related per se, but there are resources for ED management if you hit the shared repository, the AAP and Jansen. Maybe you can direct them offline, at least so we can, offer some degree of a more immediate support.
You can share your screen if you want to walk people through those steps.
Yeah. Well, I fear we're gonna go on too much on a tangent because that's ED management. We want to focus primarily on pre-hospital, but I agree, Shelley. If we have some time, maybe Jansen, you could do that with both Mickey and Sandy. So I think I've spoken enough at this point, wanting comments from you all as to what, again, this is a brainstorming session. What can we do going forward? I showed you a slide set. We can edit, we can add to, we can put a more focused slide set on capacity and consent for adolescents in the pre-hospital setting. Management of the combative patient when it comes to minors. What are your thoughts?
Well, how much time do you have? One of the things when relating to pre-hospital is in our area, typically the sheriff's department will respond to those patients, the youth patients.
You're Pinal County, right?
We're Pinal County, yes.
Mm-hmm. Okay.
And the problem here is we get the behavioral health kids that really are not behavioral health kids, which means, for instance, they don't want to go to school. So they're in a group home, they don't want to go to school, group home calls, and then the sheriff's office, depending on which one. Now, Pinal County Sheriff's Office is much better than Maricopa because we deal with both. Maricopa just automatically sends them to the ED when they really don't need to be here. It's hard. How do we combat that?
When you say
How do we
send
work on that?
when you say send them to the ED, is it an EMS transport or is it
Yes.
police? It's EMS.
Yes, they call EMS, and of course now they have to transport, and then once they get here, we can't always get rid of them again. Sorry, that sounds a little callous, but this is, as you well know, the ED is not the place for behavioral health kids, for any really child with suicidal behavior, because we in the ED, we truly do not know how to manage those kids. Now, we're very lucky. We have a child life specialist, and she actually is sitting here listening to us because I invited her, and she does an amazing job, but she's one person. And, you know, I was telling the group a little while ago, we have one kiddo here is 14 years old, has been here for 112 hours. You know, this is not beneficial for the child, nor is it beneficial for us, because this particular kid kept jumping out of bed and running away. So it takes a lot of resources for one patient.
Let alone the fact that you can't use your ED space for sick patients or medically ill patients.
And I mean, we keep them for hours. I mean, we've got one here 112, one here for 89, one here, the lowest one is here for 16 hours right now. They're not sick. You know what I mean? They're not sick. They just having behavioral problems.
Are there ulterior locations that they can be transported to, other crisis centers? I mentioned in Tucson that there are non-ED facilities that do behavioral health crisis intervention. Now they'll push back to the ED if they think there's anything medically wrong or with the patient, but they do intake for that period of time. Is there anything in your community for that purpose?
Well, I think I think we do, but the problem is a lot of places say, well, they need to be medically cleared before they come to us.
Yeah.
You know, that's another part of the problem is, you know, yeah, we'll take them, but they need to be medically cleared. Well, they come here and now whatever bed they may have had or whatever ability they had has now been taken up by somebody else. Right. So now you're, I hate to say the word stuck, but now you have this patient and you know, it's hard because these kiddos, they need activities, they need to engage.
Right.
Just sitting in a bed watching the TV is just not good for them.
No, it's there's nothing.
I don't know what we can do.
This is just a random thought. Can I say something really fast, Sandy, related to that activity thing? I did see I was trying to see what other EMS for Children programs have done for behavioral health. And one thing that they did, one place did, I think it was New England. They created some sort of like activity book that had a bunch of different activities. Is that something that could be of use, or does that already exist in your hospital that you have and it's just not, you know? I don't know if you're in a pre-hospital.
That already exists in the hospital. Okay. We also, we don't have a lot. How am I trying to spit this out? How can we train our pre-hospital people, not just EMS, but also law enforcement, because they're a very big part of what we do.
Yeah.
But we certainly have the activities in the hospital because, like I said, we have a child life specialist who literally has all sorts of amazing things for all age groups. You know, from the very little all the way up to the teens. So it's not that the activities are not necessarily a problem. Jump in, Erica, because one of the things you said was the sitters that sit with our patients.
Hi, I'm Erica. I'm the child specialist for Ironwood and Goldfield. But yeah, like Sandy was saying, like they sit here for 100 plus hours, and there's so many restrictions as to like what we can actually give them. Like they can't have colored pencils, they can't have scissors, they can't have anything with string. Like there's so many restrictions. And then you kind of run out of options when they've been here for like 115 hours or whatever it is. And like Sandy said, like we try to like give them activities and stuff like that. But we have 4 behavioral health patients right now, 3 teens and then an adult, and there's 2 sitters. So the sitters can't interact with them because they're watching 2 patients each at like the same time. But there are times in the hospital where they are one-on-ones, and I think like our sitters, and I've worked at other facilities like Banner facilities and children's hospitals like throughout the country, and the sitters just don't feel comfortable interacting with them or engaging them or anything like that. And literally all it is play. And when I worked at Thunderbird, like we tried to like encourage the sitters to like interact with them, And so we have a few here that are super amazing and great with them, but then there's a few that just say like, oh, we're not comfortable with that, you know, type of thing. So that provides like a challenge too.
Yeah.
This is Mickey. One of the things, like Sandy was saying, we do have the availability of the behavioral health facilities outside the campus, but the EMS will call in and say, you know, we want to take them there. And a lot of times our doctors will say, well, they're just going to turn around and send them back here anyway. So to save 2 trips, they'll just say, bring them here first and then have them medically cleared. It doesn't work real well for adults, and it doesn't work at all with pediatrics because they won't take them to the pediatric places. And when you've got the younger kids, it's really hard. The teenagers, we do have more availability of those places, but the kids that are between, you know, 5 and 14, they're just hard to place. Now, Banner Scottsdale is going to open up some beds. I think it's November for that 5 to 13 age group, which isn't going to be enough, but it'll be better than anything. But I don't know if EMS has an alternative, but to bring them here.
Yeah.
And speaking to the playbooks and stuff, we do have behavioral health techs here who sit with our kids for the most part, unless, you know, there's less people. But like they said, you know, you get more than one patient and you're watching, you have a variety of patients to watch. So it's hard to interact with the patients and to keep them in the room so that they don't interact with each other is hard too. So it's a difficult thing, obviously, or we wouldn't be here.
Your transporting agencies, do they take advantage of the T3G and or treat and refer program that they have? Because I mean, paramedicine, you know, the state's been trying to move towards the treat and refer concept in which they don't necessarily have to, you know, transport every patient. I'm less familiar with the processing. The EMS agency has to be applied for it, be approved, but they can treat and refer, and they can literally does not lead to a transport. They could clear the patient in the field.
Doesn't work real well with the kids though.
No,
because they're they're pediatrics and nobody knows what's going to happen. So they tend to bring them in because, and even if they call in with a patch, the doctor's most likely going to say, bring him in because it's the safest place to be here in a way,
yeah.
You know.
Is there any incentive, you know, because meeting with fire chief and making sure that they're aware, is there any motivation for the fire and or EMS agency to, and I'm sorry for making bad, is there any motivation for them to incentivize going to another location, or do you think they would not be a partner in that effort?
I think it depends on where you are, because out here in Pinal County, our transport is AMR. So it's not the fire department. And you know, in Phoenix proper, or you know, like Tempe and the other Mesa and the other departments, they have their own ambulance transfer services. So I think they can probably maybe do a little bit more, but it's really dependent, I think, on the region, whether you're doing treat and refer. We are not doing treat and refer out in Pinal County. So that's not an option.
Yeah. You know, I mentioned that Julie and I had met last week. This is very reminiscent of the conversation we had then, was that, you know, the management of these patients is so community-based. Each community is going to have to do you know, kind of take their individual approach based upon their own resources that they have. Would you see a benefit in creating an educational module on alternative management, alternative strategies, locations? We mentioned treat and refer. We mentioned non-emergency department destinations. is it simply educating those EMS agencies, or will that be in one ear and out the other? Sandy, you mentioned AMR. AMR, they're reimbursed solely based on transport. I don't think they're going to do anything but transport. But
Right. I think one of our challenges out here too, we have a ton of group homes out here. So it's a DCS issue at that point in time as well. Like, I think that's like one of our major challenges. Like, we literally had a kid come in last week and he was a 14-year-old non-compliant. He had spina bifida, and he basically was just like, I don't want to self-cath anymore, and I don't want to change my colostomy, and I don't want to take a shower or anything like that. And so they sent him to us, and he sat here for like probably 29 hours or something like that, and was trying to be sent home to the group home, but the group home was refusing him because they were going to get an evaluation from the state. So I think it was just like multiple factors, you know, like DCS, their hands are tied, the group home, their hands are tied, our hands are tied. Like, there's so many like obstacles.
One of the other things we can do is do some education on how to talk with these kids and how to treat these kids from the EMS part. Our hospital just sent out an education on kids with autism. That was very educational for me. And if we could put together something like that for EMS, may help a little. I mean, at least it's going to help them in interacting with the children. So,
all right, you like de-escalating in the field?
Yes.
Okay. Yeah, I mean that. Yeah, education modules. That's what we've done before. That's something that we can work on going forward for sure. I will admit that behavioral health is not my forte. So recruiting people who are willing to work on the slide set and things like that. I mean, the audience is definitely there. Again, we like to make our products compatible, which gives additional incentive for the EMS agencies to pick them up because they can use them for CE.
Banner has a pediatric behavioral health educator. They just came to our last PED staff meeting. Like, maybe I could get their contact information, but that might be like a good person to like, because they sent us like a PowerPoint of like different ways, and I'm like, it was more obviously specific to the hospital and not like pre-hospital, but like that could also be like a good resource.
That'd be huge.
Okay,
sure.
I'll send it out. I'll have Sandy send it out to everybody.
Okay. All right, and I'm sorry, tell me your name one more time.
Erica Jorgensen.
Erica, thank you. That's
You're
perfect.
welcome.
I'm a big fan of not recreating the wheel. There's a lot of shared resources through the internet. We've already mentioned a couple that are available. Julie, you found the one item you were talking about. You know, if we can find a module that's out there and available and it's not proprietary, then we can pull good ideas from other things and assemble kind of one that we have, and we can work towards an education module on, you know, behavioral health interactions in the field. And then ultimately a decision tree, at least a primer that says you don't have to take these kids to the ED all the time. I know a lot of our hands are tied. We're working under a broken system to some degree. And then to be honest with you, to piggyback and tag team on efforts, Jansen, maybe we can get the pediatric designation materials that may be available and kind of add that to this folder as we work towards assembling our stuff. And some of our information can jump over to your repository too.
Yeah, definitely.
Sandy, Mickey, are your sites, Ironwood, I think is a PPAC member, isn't it?
Yes, it is.
Okay. So you'll have access to that on your online repository, Jansen, if you just want to resend the link. Or maybe you guys already know it. I don't know. I apologize if I'm reading stuff again.
Yeah, it's the base camp, and if you don't have access, just let me know and I can send you a link to register for that.
All members, and it's all shared information. So anything you see that you like, scalp it and put your own name on it. That's the beauty of that group.
I agree. I think education all around will help, not only for the pre-hospital, but also for our ED staff, because they are not behavioral health specialists by any stretch of the imagination. And I think we're so thankful to have Erica here, I will tell you, because we have several kids with autism in our region too. And she works relentlessly with them. And that really helps because she knows how to deal with them. And staff doesn't, and they can actually set them off and make it a lot worse by not knowing how to do it. So we're very blessed to have her. I can't tell you how thankful I am.
Okay, great. Okay. If I'm not reading people wrong, Julie, Shelley, correct me if I'm wrong, but I think we got a winner. I think we got a project that we can start on.
Yeah, that's awesome. Thanks
Okay.
for all of your feedback, everybody.
Wow. I was struggling with this idea as to what we could do. And, you know, being at the university, education is the thing that I like to do. So I'm tickled about this one. Yeah. But I would ask everybody for some homework. Let's everybody get out there and start searching other states, other EMS agencies, see what's out there. See if we can't have a model to image and kind of build ours from. So we're not starting from scratch. And then by email, we'll all interact and just kind of share what we found. And we'll put that together. And unless one of you guys would like to at our next PACES meeting, you know, we'll have this in kind of a prepared format to propose an idea. And then we'll need to get a motion to approve. And Julia, Shelley, correct me if I'm wrong, that's correct processing for the committee, correct? I bring the proposal, we bring the proposal, or what's next step?
Shelley, correct me if I'm wrong. I think that we can work on creating something to propose. We don't have to necessarily get additional approval to work on whatever we create. Okay. Is that right, Shelley? That seems to be what has happened in the past.
Does this work group want to generate an initial PowerPoint?
Yeah, that's what I think so.
Okay.
Yeah, I just remember in the last PACES meeting, Gail had corrected me that the current motion was to assemble the work group, and then the next eventual motion would be for the project, or is it ultimately the approval of the project?
The work group can come up with the PowerPoint, a draft
Okay.
PowerPoint for the body to vote on and
Okay.
amend.
Okay, great. Because okay, I get it. Because the last meeting approved the work group.
Yeah, I know it's really confusing. Yeah, so we approved it we approved the work group at the last meeting. So then at the next meeting, if we come with a product that the work group has assembled, we'll be able to approve that as
Great.
long as it's on the agenda to approve.
Wonderful. Okay.
When is the next meeting?
So the next PACES meeting is November 18th, I believe.
Okay, so we got a few months.
Yes.
Yeah.
So what probably will be the best way for this work group is we can start compiling things and then schedule another meeting maybe a month from now or something like that, so that we can kind of finalize what we have collected and get that formulated into a PowerPoint.
Yeah, I think that's a good idea. Let's, as our homework, we're gathering data information, maybe example documents, example modules, and then let's all get together again and then kind of decide which we want to pull from each. And Erica, we need any champion we can get. I'm trying to look around the corner. So please, and your behavioral health colleague you mentioned earlier, we would welcome input as a guest to our meeting. That would be awesome. So, and to be honest with you, as someone who has a focus and expertise in that, it would be the best champion for this slide set, And then we can give our EMS/ED hospital experience to flavor it for our clientele. So that would be great.
The education committee also meets at the same date as PACES. So they share the same date.
Yes.
Which
Yeah.
means
Sorry.
when we create a project, we wait till the next quarter meeting for education to ultimately approve it. Is that correct, Julia?
Yeah. So education committee also has to approve any educational modules that we create as PACES. So it's kind of backwards, but because the education committee is before PACES on those days, but the education committee will get it on their agenda and then they'll review it and approve it. And then at PACES, we'll review it and approve it so that everyone has seen it and everyone has approved it. And then we'll be able to post it after that.
Okay. Well, I think we're done early, I guess, right?
Yeah, I think so. Thank you guys. I'm very impressed with our discussion today. So thank you all for your contribution. Do we want to get a date on the calendar now, or would you prefer that I send out a doodle poll, or does 4 weeks from today at this specific time work for everybody?
I think that timeline sounds great, Julia, but a lot of it depends on how much we have together offline, because it would be silly to meet when we're not ready yet.
That's true.
But I think we should be ready for in a month.
Yeah,
Does that work?
I think having a meeting date on the calendar might help us to remember to get to research for things. I know it helps me if I have a date. So we can, sorry, what's the date today? 24th. We can try to go for September 22nd at this time, if that works. Or I can send out a poll if we prefer to do it that way.
My calendar's my schedule's a kind of a moving target, so an email/poll would help me.
Okay, yeah, we can do that.
Okay. Great. Okay. Thanks, everybody.
Thank you.
Everybody have a wonderful day. Thanks for meeting.
Thank you, everybody.